Hello and welcome everybody to another podcast of the U of CARE. It is my pleasure to welcome today Dr. Bachir Kassas. Please, would you mind introducing yourself, Dr. Kassas?
Yes, thank you, Dr. Grundmann. So again, my name is Bachir Kassas. I'm an assistant professor in the Food and Resource Economics Department at the University of Florida. And I have a split teaching and research appointment. I am mainly a behavioral and experimental economist, and so I apply surveys and experiments to study topics related to consumer behavior and health-related decisions. And also as part of my research program, I focus on neuroeconomics, where I basically utilize psychophysiological data, including, for example, brain activity, eye tracking, pupil dilation, and facial expressions. And I use these tools to build behavioral models that can improve our understanding of the individual decision-making process in the context, of course, of consumer and health economics.
That is fascinating. If I think about food consumption as something that is related to addiction research and education, because whenever I talk to students about addiction or substance use disorders, I also bring up that there can be many other forms of addiction, and among them is food as something that we sometimes can get in association or an unhealthy relationship with. But you obviously also focus on many other areas. So what got you actually in this field of addiction research initially?
I mean, frankly, the field naturally lies within my research program. And so, of course, like as you mentioned before, addiction comes in many forms. So, of course, you have, for example, addiction related to impulsive purchasing, addiction related to gambling, food addiction, smoking, substance abuse. So there's so many different forms of addiction, and a lot of them have ties to economic behavior and economic outcomes. And so this fits really well with my research program on consumer and health behavior. And of course, addiction in and of itself is a very important topic because it presents several main challenges to our society. And it could also negatively impact various aspects of our livelihood. And so addressing these concerns, I think, provides great benefits to policymakers, health program administrators, and even the wider public. So this got me really interested in diverging into that area and looking at different forms of addiction and how it applies to different domains within economics.
This is just fascinating from the point of view. So this kind of already addresses some of your current research, I think, when you talk about health economics, health behaviors, or how this kind of shapes our behaviors and also consumption behaviors. So can you explain a little bit how all of this kind of fits together under your current umbrella of research activities and work activities?
Yes, of course. Actually, if I may, I would talk about maybe two current projects that I'm involved in, both of which relate directly to addiction in different forms, again. So in the first project, we are investigating how consumption experience and consumption memory impact food addiction behavior. And we are combining both behavioral outcomes related to, for example, consumers' valuation of different products and their choices between healthy and unhealthy food alternatives. And we're also combining neuro and psychophysiological data related to brain activity, facial expressions, and pupil dilation. So when you present people, for example, with different stimuli of healthy and unhealthy food alternatives, how do they react to these cues in terms of neurophysiological responses? And the idea here is to shed some light on how food addiction develops, basically, and also to utilize well-established behavioral biases that we know in economics. And these biases are related to food consumption and food experience. So how do we reutilize these behavioral biases to combat food addiction and to nudge people towards healthy food choices and food behavior generally? The second project is related to smoking cessation, and this is actually a project in collaboration with some faculty members from the University of Florida. So this is including Dr. Sarah Jo Nixon from the Department of Psychiatry, Dr. Ramzi Saloom from the Health Outcomes and Biomedical Informatics Department, and also Dr. Jesse Dallery from the Department of Psychology. And the main aim here is to understand the self-control mechanism in the context of smoking cessation. And we're basically building our model on two main but competing hypotheses in the literature. So the first hypothesis views self-control as a perishable resource, or basically, if you can think about it more like a muscle. So the more you draw on this resource, the more you fatigue the muscle, and this will impede your subsequent self-control ability. The second hypothesis, which again is competing, it provides contradictory predictions. It views self-control as a knowledge base. So basically it says if you exert self-control initially, you gain access to this knowledge base in your capacity, basically, and this helps you improve your self-control ability subsequently. And so what we are trying to do is to build a unified self-control model that builds and borrows elements from both perspectives. We have done so already in the context of impulsive purchasing. So we defined what we call the dual self-control model, and we're trying to extend this approach to smoking cessation. And again, here we're also focusing on behavioral outcomes related to smoking abstinence, and also neurophysiological outcomes related to cue reactivity to smoking cues.
These are two fascinating topics. So if I think about behavioral or just the relationship we develop with food as individuals, how this is such an often ingrained behavior, right? Because I have two small kids now, and obviously we want our 2-year-old to kind of eat her healthy food, her vegetables and fruits. So there's she isn't necessarily yet exposed to like the advertisements that go into that and associations with, whatever associations we make when we see an advertisement and certain food items or something like that. But yet there's this ingrained behavior, for example, with certain vegetables or fruits and stuff like that. And then with whatever chicken McNuggets or chicken nuggets, I don't mean to advertise for a specific company or anything like that. But so how can we modify such ingrained behaviors then, if it's really something that we sometimes build up at a very young age?
This is actually an excellent question. And of course, I think we all know what types of food are healthy and what types of food are unhealthy. And the field of behavioral economics has been looking at this for a long time. And it's really confusing, of course, to a lot of people that, given the knowledge, like, for example, I know that this food is unhealthy. I know the negative impacts that it could have on my health and, all the health complications that could arise from continued consumption of a certain type of food. But we still all indulge in this type of food, right? The unhealthy, high caloric content, high fat, high sugar food. And so, there's a lot of different behavioral interventions that were put in place to help people exercise more and choose healthier products. But I think if we really want to get at the heart of it, we have to get at the base human instinctive behavior, which is, I eat this food because it tastes good, and I have a pleasant consumption experience, and I have a pleasant consumption memory. So this is basically alluding to the fact where, you see this like advertisement that you were talking about, for example, chicken nuggets or, like candy or any type of food. It basically activates your consumption memory because you've had this type of food before, you enjoyed the experience. And so when you look at it, this definitely activates that memory. And so it drives you towards that type of food. And so if we really want to get to the heart of it, we have to understand how consumption experience and consumption memory impact our behavior, because this is always related to the dopaminergic system in the brain, the reward system, right? So I draw on stuff that maximize my reward and maximize the concept that we call in economics, my utility. So my happiness, my satisfaction, basically. And so it's very important for us to address this point if we want to help people, go towards, for example, healthier food choices. So the idea from our research is to borrow from behavioral biases to sort of distort the consumer's perception of the consumption experience with different products and see how that impacts their food choices later on. So if basically you were to have a very pleasant consumption experience with a food option that is healthy, how does that impact your behavior subsequently when you're comparing that food with an unhealthy alternative?
Yeah. So now sometimes we refer to like some of these very high caloric density foods as like comfort food, for example, like mac and cheese that are like dripping with sometimes fat or something like that, or very heavy in cheese or so. When it's already associated with that kind of, I need this in order to feel better, or, you had a bad day and you just want to indulge in ice cream, or, you need chocolate to feel better because it triggers that reward, system in the brain, dopamine system. It seems to be such a strong connection that you make that, now switching to peas and carrots or eating a salad just seems to be not possible for most of us to make that new connection and all of a sudden have that same reward trigger for it. I would personally not be able to imagine that because I run on sugar. So for me, it would be extremely hard to rewire that. So,
of course, this is a great point. It's a great actually question. So to think about, for example, like when you think about the whole process in one step. So, for example, going from indulging in what we call the comfort food or the soul food, sometimes I think they use that term. It's almost unimaginable to think of, switching immediately from that type of food to peas and carrots. I think taking, the snowball effect, which is, again, like a concept in economics, as in if you want to radically change behavior. So basically it happens through, it's a step-by-step process where you take baby steps towards, the ultimate goal of adopting a healthier lifestyle in terms of your food consumption and your food choices. And so, like, for example, in our project, we're comparing apples to apples, so to speak. So we're comparing a snack with the same exact snack, but a healthier alternative. And so making that switch would be, for example, a more reasonable first step towards, adopting a healthier diet, right? So if I'm, let's say, replacing, for example, the ice cream with another version of ice cream, but for example, that's healthier. It has less sugar, or maybe yogurt based, or some healthier form of a similar like alternative product. It's a more reasonable first step. And then of course, like you can take the research forward from that level to like more healthy alternatives, and then slowly but surely you can start building that connection of how do we form a connection basically between pleasant consumption experience and healthy foods. So I think at the heart of it, you need to start building that connection, because right now there's a very, very strong connection, as you said, between the comfort foods, for example, and pleasant consumption experience, and even memory, right? So when you see this food, I'm like, I'm in a bad mood. I need this food right now because I know this food is going to make me happy, right? Yeah. So you start building a connection between happiness and healthier alternatives, then maybe you start drawing on these memories when you get put in a similar situation.
Yeah. So, I mean, there's obviously a bunch of implications that I just can come up with from your research, just from both an economic impact, where I would guess that a few marketing campaigns of a few companies that are advertising the non-healthy options might not be so happy with your research, and those who are advertising for healthier options might be quite pleased with your research. So where do you see the major implications for your research, both on this front, food consumption, and also the smoking cessation?
I mean, frankly, I see, as I mentioned maybe before, I see some potential useful implications for policymakers, for health program administrators, and for the wide public. So we basically focus on providing recommendations that can help policymakers adopt programs or interventions that can combat addiction in different forms. I think one other implication, it lies more heavily with the research field itself, because I think my research area pushes the frontier in experimental economics by tackling the area of neuroeconomics, which is a relatively new area in the field, but it's been gaining some momentum recently. And so I think by combining conventional behavioral outcomes with neuro and psychophysiological outcomes, I think we can open new possibilities in the field of neuroeconomics or experimental economics generally to address innovative and impactful research ideas. And I think also one interesting element is by studying addiction in different forms. So as we said before, for example, addiction and impulsive purchasing, addiction when it comes to gambling, food addiction, smoking, and drug abuse. So we can sort of like start building this common ground of behavioral and neuro and psychophysiological indicators that could signal addictive behavior. And this will help us understand how addiction develops in different domains. Because if we can understand the base of this behavior or this phenomenon, then I think this will unlock possibilities for us to be addressing addiction in different forms and improving the livelihoods in several aspects for different people.
So I have no doubt that your research is targeted towards improving the lives of people, but if you obviously want to address the core issues and the central issues of how can you basically change behaviors from an unhealthy behavior to a healthier behavior, does that also mean that potentially this could be used in a way to focus somebody really on a particular product, basically to really make them a consumer really honing in on this particular product, basically forming a new addiction?
Yeah, so of course, like if you think about it that way, I mean, any research really, if you think about it as a tool that you can use for different underlying objectives. So yeah, I mean, you can tailor any research program to maybe, for example, in this specific case, you can focus it on a product. My research program, frankly, I don't really focus on specific brands or specific products. I focus on the common good of helping people, helping the wide public, and also helping health program administrators and policymakers and doing their jobs more effectively by providing new insights that they can integrate into their existing interventions and programs.
Yeah, I think that's an important kind of thing to say or bring to the table, that we want to shift things into a direction where consumers feel empowered to change their behaviors, where policymakers can actually make an impact and really empower people to make better choices for themselves.
Exactly, yes, and without any focus on a specific brand or a specific product.
Yeah. Because we have seen, how marketing can work very much to hone us in on particular products and make them very appealing to us by neglecting certain aspects of that product. So where do you see the major obstacles then, or the challenges currently for your area of research that are really facing the community, society at large, and how do you see they can be potentially overcome within the next years as it relates to addiction research and education in general?
So I think I can mention maybe one element that I see as both a strength and a potential challenge. So the nature of this research area, addiction, it lends itself really well to different domains, majors, and disciplines in academia. And so I see this, of course, as a potential opportunity for people to come together and to collaborate on the common purpose, basically, of addressing addiction in its different forms. But I also see this as a potential challenge because I think there's a certain degree of disconnect right now between different disciplines and majors that are working on topics related to addiction. So in my experience, I think different societies and different majors and disciplines, they focus on their own journals in terms of both readership and publication. And so, of course, every major has their reputable journals that faculty and researchers strive to publish and get some presence in. I think lately we have been seeing some interdisciplinary collaboration. Actually, one of the research topics or projects that I talked about, the one with smoking cessation, it's an interdisciplinary collaboration with various different, disciplines and backgrounds. And we have been seeing some, like more collaboration on that level between departments and disciplines. And this is, of course, a great thing because it's helping address this challenge. But I think we still have some ways to go before we reach a desirable level of collaboration and communication between the different departments. There's great discoveries, of course, in this field that would take a leap forward, basically, in our ability to address different challenges and different issues related to addiction. Of course, also technological advancements is something that's been great for us because it opened up new possibilities for us to study new, for example, outcomes that could shed more light on things that we have discovered in the past, and we basically increase our understanding of these concepts. But yeah, I would like to see more collaboration on an interdisciplinary level between different departments and majors on this field. I think the Center for Addiction Research and Education does a great job in bringing people with different backgrounds together to work on these issues.
Yeah, I couldn't agree more. I think that the CARE definitely has done and is still continuing to branch out into new areas, and specifically your area. I think this food issue is just so interesting to me because we often reference it when we talk about substance use disorders as one of the basic human needs, food consumption, and how we can have this very, very strong associations with food consumption and preferred foods, and how this kind of then different types of addiction, and that it basically is very much a similar process when we have this reward mechanism and reward pathway. So I think looking just at that is just, there's so much overlap when it comes to the neural circuits that are involved that it lends itself to collaborative efforts very well. Yeah. So I completely agree with you on that. Yeah. So more to come when it comes to mapping and understanding what is going on between our ears and behind our eyes.
Of course, yeah, it's a very interesting area, and yeah, I'm really excited about the new developments in this field, and excited about doing more research that can help people in addiction in different forms.
Wonderful. So, Dr. Kassas, thank you very much for your time today, and I really look forward to seeing new research coming out of your group, out of your lab, and hope that other youth CARE members, the general public, and others at the University of Florida and beyond are looking out for your research as well.
Thank you very much. Thanks again for inviting me to talk on this podcast. It was great sharing, some of my research and insights, and great talking to you. So.
Okay, was my pleasure as well. Thank you everybody for listening, and look out for a new podcast coming up soon. Take care, everybody.